TV live.
Talk about breast cancer. Not only women are prone to it, men are also prone to it, but the rate is very low as compared to women. Today, or in this whole month, we are discussing breast cancer. We keep talking about the pink month, the pink month, the pink month. But what the pink month is all about is what we will be discussing today on Regulators. And I hope that you stay glued to your TV set, welcome us into your homes, and let us stay through to the end of the program. This is Regulators. My name is Nafa Ali. I'll be back after the break.
You beat cancer by how you live, why you live, and the manner in which you live. I am Priscilla Sewamenu, Miss Health Ghana 2020. The month October is noted for breast cancer awareness, and this October, Sonotech Ghana is partnering with Miss Health Ghana to bring you breast cancer awareness campaign dubbed Pink It Out. So from the 1st to 31st October, Sonotech Ghana is offering free breast screening for all women out there. Plus, you get 20% off mammogram and 50% off ultrasound scan if you need one at any of their branches. The campaign is on. Join the campaign, support women, encourage women to come for screening, and support women living with breast cancer. On this note, I will entreat all my sisters out there to come detect it, treat it, and defeat it, because early detection saves life. Thank you.
Thanks so much for joining us on Facebook, Adoatv Ghana. Don't forget to like and share our page so that you miss out on any information. Welcome back. This is Regulators. On my immediate right is Dr. Benjamin Fenu. He's from the breast cancer unit of the Kolibu Teaching Hospital. And to my far right is Mr. Albert Robertson Mensah. He's the head of business development at Sonotech Medical Diagnostic Center. I forgot to tell you that we are doing this with the members or group from Sonotech. They're going to tell us what this whole thing is all about, from the 50% discount on all breast ultrasound and then the 20% discount on all mammograms. And the duration is from the 1st to the 31st of October. So the whole of October, any of the branches you visit, Osutema, West Hills, you get this particular, you will get to enjoy all this. So do all to join them in this campaign. Now, let me start with you, Mr. Robertson. Sonotech has been doing this for quite some time now. What has been the impact? What are you looking out for? How many people are you looking out for to come and then do the free breast screening?
Okay, so over the past years, or I think about 5 years now, we've been on this very journey. And the impact, I would say, has been so great.
Okay.
So in last year, we were able to screen over 2,000 people. That is Sonotech, only Sonotech. Screening over 2,000 people.
Robertson, can you speak loudly a bit?
Okay, so
yeah.
Can I take off?
Yeah, you can, if you're comfortable. Yeah, you're correct.
So I just said that for over 5 years now, we've embarked on this very journey, and it's been very, very impactful.
Okay.
Yes, because I think last year we were able to screen over 2,000.
Wow.
Yes.
In 1 month?
Yes, in the whole month of October.
Okay.
And so we had some partners, which I can boldly say that Adoatv was part, and so it aided in spreading the information, which made many people get to all our branches to be screened, and we are so grateful.
So anyone at all can walk in today?
Yes, it's open. I mean, from 1st to 31st, we are open from morning till evening.
Okay, what time?
Yes.
What time in the evening?
From morning. I mean, it's a 24-hour clinic, so we are open from morning maybe to another morning. You can just get in there. The only thing is that, I mean, the screening is being done by the nurses, being supervised by a doctor.
Okay.
So in case there is anything detected, they would talk to you
about
so they will prepare you to meet the doctor. Who in turn may also do the screening and then just tell you the way forward. And that's what we are doing for the whole month. And so for our branches, Osu, Tema, and then West Hills, it's all open. Yes. Any other, I mean, whoever, you can walk in. We are open. We will serve you right.
Now, do we only hear about Sonotech when it comes, or when we get to the month of October, the 10th month?
No.
Okay.
No.
So what is Sonotech up to?
Okay, so Sonotech is a diagnostic center, and also it's now a clinic, a fully fledged clinic, if I may put it that way. Because we started as a small diagnostic center in ultrasound. Okay. Just around Osu, and now it's one of the largest and then the fastest growing diagnostic centers in the whole of Ghana, if not West Africa. And we are offering wider range of services.
Okay, such as?
Yes. So we have mammogram, we do CT scan, we do MRI, we do X-ray, we do ECG, we have, I mean, both specialists and then general practicing doctors available. We also have our ultrasound, and the ultrasound we do 2, 3, and then 4D ultrasound. I mean, the one that you can even see your baby is right in your womb. I mean, we offer all these services. We do ECG, EEG. We do the monitoring one. In fact, I mean, anything ultrasound, you can
count on Sonotech.
Sonotech, and you'll be sorted.
Thank you very much. I'll get back to you. Now, doctor, who can easily walk into a clinic, especially a girl? At what age can a girl walk into a clinic and say that I want to get my breast examined?
So, we say that once a lady turns 20 years, she should start examining her breast. So that's monthly. So what we expect is that because of the influences of the hormones on the breast, it's good to assess the breast 3 to 5 days after the start of the menses, and that would make any lump more obvious, or less difficult to fill. And you're supposed to do it every month, so you choose a day in the month that you decided to do that routinely. Now, for assessment by a healthcare worker, we'll say that if you've had no challenges, Then every year you can have that examination by a trained healthcare professional. For those that we've been monitoring, we've been following up on, usually we'll do 6 months assessments. We start gradually from 3 months, 6 months. That's assessment by a trained healthcare professional. But for screening purposes, for someone who hasn't got a challenge, and the only reason is to make sure he detects or screens himself, is the monthly self-breast exam, and then yearly assessment by a healthcare professional.
Okay, so who stands the chance of getting breast cancer?
So when it comes to cancers generally, and for this matter, breast cancer, we don't have a particular cause for the cancer. What we can say is that, or what we can associate with the person, are what we call risk factors. The risk factor means that there's something about a person that makes the person have a higher chance than his neighbor or another person. So, well, breast cancer is basically a disease that concerns women more than men. So the most important risk factor is breast cancer. Age has become a very important factor here. The peak ages that we find, those between 40-49 years.
Wow.
However, we've seen young people as young as 14 years, 16 years, who have developed breast cancer. It's worrying. Yeah, so regardless of the ages I've mentioned, I mean the peak ages, 40 to 49 years, we say that once you notice anything that is unusual about you, I mentioned earlier on that from age 20 years, a lady should start examining her breast, and the essence of it is that you get to know what your normal is with time, so that when you detect anything, then you'd report to us. Now, the other risk factor, certain lifestyles, excessive alcohol intake, tobacco, these things contribute to development of, or having a higher risk of developing breast cancer. For some people, what you can trace is maybe a first degree relative or family member.
So it's some sort of like a hereditary factor? Yes,
there are hereditary factors. Yes. So a first degree relative is parents or the siblings. Some you can even trace to a maternal auntie or grandmother who may have had breast cancer. Yes. And so we look out for these things. Unfortunately, we don't have the means of checking the genes here as is done in the West, where you can trace and see if you have those traces, where we have a pattern or a particular pattern occurring in a particular family. Yes.
So if we have it in that family, you realize that probably your great-grandmother had it, your mother had told you that your great-grandmother had it, your grandmother had it. What are some of the things that we could do to, break that chain?
Yeah, so when it comes to breast cancer, is it the preventive measures, it's important to know that, yes, even though there are lifestyle modifications and those ones, but it's noted that it's only effective up to about 30% of people. That's if you are practicing lifestyle modification. And then also in more than 50% of the patients that we come across, you cannot actually trace to any risk factors, nor hereditary pattern. So it makes it difficult. Of course, one of the important things that I failed to mention earlier on was someone who has had breast cancer in one breast and had treatment stands a higher chance of developing breast cancer in the other breast. In the other breast.
But not the same breast.
It still can happen in the same breast. It can, what we call recurrence. It can come back again. For some reason, it can develop breast cancer in the other breast. Sometimes it's basically the same cancer in the other breast that may have spread to the other one.
Okay. So, but why does it reoccur in the same breast again, even after it has been removed?
Well, cancers are very difficult to understand. Up to now, we are yet to. But it's all has to a number of factors. So the stage at which it was treated is very important to us.
So breast cancer
adequacy
also
of treatment.
stages?
Oh yes. Okay. So there are stages. There's an early one, stage 1 and stage 2, which we consider to be early, and then stage 3 and 4, we regard those to be late breast cancer. So usually, if you have a lump that has gone past the size of 5 centimeters.
So 5 centimeters. We are talking about how long?
Maybe 2/3 of the length of my finger.
Your finger. Okay.
Yes.
Okay.
That's a good measurement. If you find the appearance of an orange peel, those dots on the skin, these are signs that the cancer has. So some sort
progressed. Of like a rash or something?
It appears like a rash. It's not typical, though. I wish I had pictures. But when you have an orange peel and you squeeze it, those dots that appear on the surface. That's how it appears on the skin. So it's also one of the signs that it has developed. If you find some sores, or in our term we say ulcers on the breast, it's a sign that it's progressed. If it has,
so that stage is what, stage 2 or 3?
Say stage 3, stage 4. There, that's what we are counting. The other thing is that if you find out that it's gone to any other part of the body apart from the breast and maybe the armpit, then this is stage 4 disease. So you are looking at breast cancer that has spread. When you find out that it has gone into the bone, it's gone into the liver, it goes to the brain. It can go to almost any part of the body, but the common sites are those I've mentioned. It can go to the other parts of the breast and then the neck, what we call lymph nodes. For some people, you may not have felt any lump.
Any pain?
Typically, they don't come with pain. Okay. Usually, cancers or breast cancer will present with pain when it's advanced. So that's one thing that's worrying. People have breast lumps, and because it's not painful, most breast lumps are not painful. In fact, when you have pain, we think that it's benign. It's more likely it's benign from our experience in practice. But the painless ones are the ones we need to pay attention to.
Now, I want to ask about this. If it gets to what stage do we need to go for a surgery? Stage 1, stage 2, stage 3, stage 4.
Yeah, so when it comes to surgery, well, what we say is that in our knowledge, once the cancer has spread to, it's spread beyond the breast and maybe what we call the lymph nodes in the armpit, and gone beyond, gone to the bones, gone to the liver, gone to the brain, then surgery hasn't got benefits. When we weigh the benefits, you didn't benefit much, so we wouldn't operate on you.
So what will happen?
But yeah, so well, we have other means. So when it comes to treatment of breast cancer, it's not surgery alone. There is chemotherapy. There is what we call hormonal therapy. So we'll give you some tablets or pills that can control or slow down the progression of the disease. The chemotherapy we usually want to give chemotherapy for cure if it's possible. But when it becomes, when it has spread, then we would have to give the chemotherapy as a palliative measure. And the regimen we use are quite different from what we use if we are targeting cure. There is hormonal treatment, as I have mentioned. It's known that for some people, the cancer feeds on the hormones, the estrogens that are produced by the body. Yes. So when you give drugs that block these hormones, then effectively are depriving the cancer of, in quote, food. And so that slows their progression.
Is it that it dies down or it slows the progression?
For some, you can have regression of the lump itself, but it's mainly to slow down its progress. If we attain a stage where it regresses, then yes, that's a good response to us. And similar responses in chemotherapy. For radiotherapy, we use it to control the disease locally. So especially when someone comes and it's too is such that we cannot operate on the person. It may not have spread, but we cannot operate on the person.
Is it because of the size of the breast or something?
Yes, it may have. If I had pictures, I would have shown you that for some it's invaded the skin almost everywhere. If I go and operate, I wouldn't be able to even close the wound. It wouldn't help. You bleed so much, I will not be able to close the wound. And so it makes it difficult to see that I'm going to operate on such a person. And the chance of the cancer coming back is also very, very high.
At
The
that
other
stage?
thing, yeah, at that stage. The other thing too is I may not even be able to remove the tumor because it may have invaded into the bones that cover the chest, the ribs, and all that. So it becomes so difficult to operate. In which case, radiotherapy would come in. For some people too, they may be bleeding a lot from the cancer, and radiotherapy helps to stop this bleeding.
Yeah. So if someone experiences after testing, we know for sure, I want you to do this demonstration for us. We are always told to lift our hands, put it on top of our heads, and then use these 3 parts of our fingers to massage round the breast. So kindly go over it for us. I would like for you to do that for us.
Okay, so having gone through the exam most of the time, you need to have a mirror. It's important. The spouse could be your mirror, though, if the spouse has been partaking in the breast exam monthly. So you stand in front of the mirror first, and with your hands by your side, you assess the skin and the nipple. You assess all the area that the breast covers. And then you raise your hand. When you raise your hand up that way, it lifts the breast. And then also, if there's any lump in the breast that's not obvious, because one of the things that the breast lump or the cancers do is that they have a way of drawing the skin inwards. In our term, we say tethering, to tether the skin inwards. So you find that it's doing that. Some of the masses become more obvious when you lift up the hands. And also it affords you ability to examine the areas under the breast. And for some, because the breast, especially the those middle-aged to elderly, they may have had, the breast, excuse my language, may be sagging. So you have to lift it up and examine under. When you have done this also, you inspect the armpits, all in front of a mirror, or a spouse, or a confidant. Now, when you are done, you start feeling with the flat of your palm or those 3 fingers. If you go pressing like how you handle it, you feel lumps everywhere. So there's
actually a lump in the breast already, but the extra one is what we are talking about.
No, they are not lumps per se. Yes, but if you feel them this way, they will feel like lumps. So you need to press them against your chest.
So whatever is in the breast, what do you term it? What
it's breast tissue, maybe normal breast tissue. There may be changes that, as though with the hormonal changes in your body. Yes, yeah. And for some, they are lactating, so the whole breast may feel lumpy. So we need to go with the flat of your palm against your chest. So you go that way, and you feel. You can start from areas far away from the middle and go in a particular fashion. So you can go clockwise or anti-clockwise. And when you do that and work out towards the middle and still press against your chest. And then you go into your armpits and see if you can feel anything unusual. And you do this on both sides. When you're done,
including men?
Well, nothing stops a man from, especially if you identify yourself to be high risk, nothing stops a man from doing that. If you have that self-awareness or that consciousness to do that every month, especially when you are in an older age group, nothing stops you. So yes, when you are done, you need to try and express something from the nipple. And as I said, as we say most of the time in our educational messages, if you find any nipple discharge, especially when it's bloody, you need to report that. So for some people, the only sign, they may not have a lump.
Okay.
For some, the only changes you can see that's of the skin. For some, it's just the nipple discharge. And for some, there will be no lump in the breast, but there's something in the armpit. And for very few, there is virtually nothing at all. They may have something, they may have been picked up through screening. When they may have gone for a mammogram, with an ultrasound, just for their routine checkup, and then something may have been found. And if it's not even obvious, may have followed up on with an MRI. I think the last time we had one of our survivors stand up, and hers was detected only through screening, through a screening process, and she followed up with an MRI. I think she shared her testimony with us. So yes, that's why we advocate for the routine screening. It's not a disease that you can prevent. It's been shown that the preventive measures are just up to about 30% efficient. Yes. So what we preach is early detection.
Save lives.
Yes, early detection and effective treatment. We say effective treatment because basic treatment are not at the right place.
And not do it properly.
And not do it properly. Yes. So early detection and effective treatment saves life or lives. And when we say effective, that's why in our campaign, it's not just about teaching or spreading it, but even healthcare professionals are trained. We have lectures, we have workshops. Perhaps COVID has slowed things down, but that's what we used to do routinely every October. We have lectures, we have workshops, and this highlights some of the things, new things, the challenges, what we are seeing, the patterns, and what we need to do to improve our skills as well. And then to the general public, what we need to do to detect it early by ourselves, and then why we should report early.
Okay. Now, before I move to Robertson, I want you to tell us one of the myths surrounding breast cancer is that when it is sacked, it lowers your risk of getting breast cancer. I don't know if it is by the babies or by your spouses, but can you clear the air on that for me?
Well, so I'll say that growing up in medical school, one of the risk factors or one of the factors that was associated with say a relatively lower incidence of breast cancer was breastfeeding. So yes, it's been documented in books that when a woman breastfeeds, the chances of developing breast cancer is less relatively, even though that's in terms of risk factors is quite low on the radar. So, well, as to whether the breastfeeding is to be done by a minor or an older age group, I think I'll leave it to the audience. But what we know is that in terms of detection, a lady is most likely to detect the presence of a breast lump if she had another person touching. We've had people whose spouses picked up the lumps. They themselves have never felt the lump, but their spouses had seen or detected something unusual about their breasts, and on that account they reported, and we found out that they were breast cancer and they were picked early. So that's a plus, I would say.
Kudos to those spouses. Now, Mr. Robertson, tell us, after all this is said and done, I mean, you've seen this lump in your breast, what would Sonotech offer?
Okay, so for the past years, we've been offering a lot to the breast cancer unit, because even after Kolibu, yes, and when they are one of our major partners when it comes to breast cancer awareness. So for the past years, we've partnered with them for this very journey, and even during and after the October, the Cancer Awareness
Breast Cancer Month,
we do get people then coming in to request, yes, for free CT scan, which Sonotech does without any hesitation.
Wow.
Yes, The only thing is that if it's coming from a recognized facility, like Kolebu, then we can say perhaps the person is not having the means to do it. So we do it, and I can say we've done many. And just recently, when we embarked on this very year, I can mention like 4 cities that we've done to support patients. Yes, yeah. In fact, when they call you, I mean, if you listen to their voices, I'm telling you, you will cry for them. Because you can feel within their voices that really
they don't have.
And Doc will testify that the treatment is very, very expensive. Yes. Sometimes I just don't want to go there. But recently, we had to pay for a chemo, and it's 3,000 per session.
Wow.
And assuming maybe you don't have the means, you are doing, we did averagely like 6 sessions. And so if you don't have the means, how would you, go about it? Some may come, in fact, what drives Sonotech into this very breast cancer is when we lost one of our major or our loyal customers. In fact,
to that.
Yes, I can tell she was there and then it was detected. But I think she left and then she was ill-advised. So she went to
unprescribed meds.
Yeah, and when she came, I can tell that day I was at the front desk, I couldn't even make her out.
Wow.
Yes. It was her daughter who walked to me and, is that your mom? And she was like, yes. And we eventually lost that very important person. And so, in fact, it drives our emotions when it gets to October. So I can tell you, we don't joke with October. We just don't joke with October. This time round, what we've done, from the very first day we did the launching, we had Prof. Clegg Lamptey doing the talk for us with Dr. Nsafu doing the launching. And it was done, it was an online something. So we had people, joining. It was very, very nice. And I think that means also open it up for people to join. So we have people joining online through Zoom and other things, and it helped in promoting the awareness month. So what we are now doing is going to places to do screenings. So far we've done 4 places.
Which places?
Yes, we've done one ICGC. Around New Botiano. We're there this Saturday.
Off the Kaswa Road.
Yes, off the Kaswa Road. We did that place, and I think that same day we had to embark on a walk, creating awareness at the Makeup Ghana. We did it around Chado area. We finished, and then after the walk we had screening and then talk. For all these places that we've been to, we usually will do the talk where people will ask questions. So like you ask this myth about things, people thinking that perhaps if they suck your breast, you won't get breast cancer. Those things are there. And in fact, someone was even asking questions that, in fact, it's really informed me that people are not informed about breast cancer. And so I don't. And then if I look at what goes into breast cancer for Sonotech, it's nothing small. But we need to do it, and so we continue doing it.
Interesting. Thank you very much. I'll go for a quick turn. When we come back, we're going to talk about the some of the myths and then the treatment plans for breast cancer patients.
Hello everyone, my name is Adoatv, a proud ambassador for Sonotech's Breast Cancer Awareness Month. It's hashtag Pinktober, hashtag Sonotech Goes Pink. Now from the 1st October to the 31st October 2021, at any of the 3 branches of Sonotech, Tema, Osu and West Hills Malls, we are gathering together to get free screening. Yes, I said it's free. And that's not all we have for you. We also have 20% off mammogram testing and 50% off ultrasound. Let's go pink from October the 1st to the 31st, 2021 at Osu, Tema, and West Hills Mall, all Sonotech branches. We are giving hope to save a life. See you there.
Wow, October is here already, and it's time for the world to go pink and pay attention to the chest of a woman. My name is Rebecca Donko, the founder of Makeup Ghana and the president of College of Beauty, Art and Entrepreneurship. And I'm excited about being the campaign ambassador for this year's Breast Cancer Awareness Month, an initiative by Sonotech Medical Center. And I consider this initiative a very important CSR, and I'm glad to be associated with an intervention which seeks to give hope and save lives. Awareness surrounding breast cancer is very important as it provides information on early detection and management. And these timely information can save lives. Know that breast cancer is treatable and manageable. So the whole of October is Breast Cancer Awareness Month. Get screened at any of the 3 branches of Sonotech Medical Center, either the Osu branch, the Tema, or the West Hills Mall, with 50% discounts on breast ultrasound and 20% on mammogram. And remember that breast cancer awareness is important, but so is breast health awareness. So let us all endeavor to play our part in giving hope and saving lives. Thank you and stay blessed.
Ago, good people of Ghana. Here are some safety measures on prevention of coronavirus. 1. Cover your mouth with tissue when you cough or sneeze. Dispose of tissue into a bin immediately you cough into it, and wash your hands with soap and the running water. Avoid shaking hands and use sanitizers as often as you can. Signs and symptoms of coronavirus include fever, cough, sneezing, and difficulty in breathing. Should you experience any of these, or for more inquiries, please contact 0558 439 868. That's 0558 439 868, or call 0509 497 700. That's 0509 497 700.
Remember to always wash your hands with soap and the running water.
This message is brought to you by the Ministry of Health, the Ghana Health Service, and partners.
Welcome back. Thanks so much for staying with us, but we're going to have this last bit and then we'll call it a night. Doc, so we've realized that most pregnant women, when they are pregnant for the very first time, they have the lump, they go take it out, and so most of them are not able to breastfeed. They get pregnant the second time and it comes back. What are the reasons? So
we know that there are hormonal changes that come with pregnancy. Okay. They may have had a lump before they got pregnant, or in the course of getting pregnant. And not all of them are cancers, but they need to be watched. They need to be monitored for the fact that it could be cancer. and especially depending on the age of the person. So relatively, for someone who is younger in the 20s, you find a breast lump, you'd want to do an ultrasound and then see what it is. But the person is older, you have no choice than to still use the ultrasound because the person is pregnant. You can't use mammogram because it has forms of x-rays. So yes, there isn't a particular reason why
it comes.
These breast lumps come. Some lumps are because of milk production, so they may form some lumps which are still with the accumulation of the breast milk. There, some because of the hormonal influences, the engorgement and the engorgement reduction leads to some residual lumps that form in the breast. In our terms, we say it's an aberration of normal development, and you need to, yes, it's a monitoring and then treatment appropriately. You could leave it for a woman to deliver and then remove the lump. That's when you've investigated it enough and know it's not cancerous. But when it's cancerous, then you need to start
do something about it.
Intervention.
Okay. Now, how expensive is the treatment when we mention breast cancer? Is that a reason why most people opt for unprescribed meds, or they opt to go through the orthodox type of medications and stuff, or the traditional method?
So yes, breast cancer and then chemotherapy, I mean cancer treatment itself is generally is expensive because, and it gets more expensive when it comes in, the person comes in late.
Okay.
So yes, I'll say it's expensive, but coming in late makes it more expensive.
Okay.
Yes. However, well, I think in terms of cancers, is probably one of the very few or only cancer that is partly sponsored by the National Health Insurance.
Breast cancer?
Yes.
Okay.
For many other cancers, they are not even on the insurance.
So this is okay.
I would say it's okay.
Health insurance has taken part of it, so
yes, in a way, but definitely radiotherapy is expensive. You are looking at 6,000, about 5,000 to 6,000 cedis. That's minimum for a
every session.
No, that's for a session, the complete treatment. If you are undergoing radiotherapy for 5 weeks or say a month. If you are using a linear accelerator, then you are looking at double the price, and that is huge. The surgery bit, I'll say the cost of surgery is also partly covered by the National Health
So like
Insurance.
how much are we talking about here?
So I'll say that the admission and cost of surgery, you are looking at somewhere from small knowledge I've gathered in our practice, somewhere around 1,800 cedis to 2,000 cedis. If you are on insurance. If you are not on insurance, then the figure is double.
My camera lady said, "Ish." So 2,000 cedis.
Yes.
We are talking about 5,000 plus for radiotherapy. We are talking about chemo too. So you can do the calculation yourself.
Yes, but you see, interestingly, people have been to the herbal treatment or the alternative medicine.
They have had cure?
No.
Okay.
I'm talking about the cost.
Okay.
Yes, you find out people have spent thousands of Ghana cedis, and sometimes they are so angry because they have thrown money away. Okay. They've not seen improvement. And they've thrown money away, and yet their disease has also progressed.
So we shouldn't even go through that. We should go straight to the hospital.
Yes, so that's what we are advocating. That you see, that's the effective treatment bit.
Okay.
That you should have the appropriate treatment. That should be effective. Drinking herbal concoctions would not help.
Now, Mr. Robert, let me come back to you. Now, this month we are giving us 50% discount on all breast ultrasound.
Yeah.
So if I should get a prescription from Kolebu saying that I should go for an ultrasound, and I get it Sonotec, I'm going to get it done.
Yes.
So how much is the slash price that we are talking about?
Okay, so the breast ultrasound is around 200.
200 cedis.
Yes.
Okay. So now we are talking about 100 cedis.
50%. Yeah, I mean, yeah.
Relatively.
Yeah, relatively. like 100 cedis, and then the 20% on the mammogram ends up around 200, because the mammo is about 250. So 20% off will be 200. Yeah.
Okay. So you are paying 100 cedis for the ultrasound.
Yeah.
Till 31st of October, you are paying 200 cedis for the mammogram.
Yeah.
Okay. And after October, you're not going to increase.
Yeah.
I mean, you're not going to increase the.
Oh no! It will get back to its normal price.
So now, if I sit here today and no one in Kolibu or any doctor has told me to go for the ultrasound, I cannot come for the ultrasound.
No. So what we are doing is that, as we are doing the screening at our end, whatever is picked up, you'll be advised. Yes. So upon the advice, maybe you'll be given a request, just as it's been done by any other facility, because when they detect it, and then there's that need for you to do further exams. Maybe you'll be definitely be given a request to go out with. Yes. So that's when you enjoy the percentages. Yeah.
Now, before we go, why should we even visit Sonotech? I mean, after Adoatv has partnered you and all that, we've seen great impact. But tell us.
Well, why should you visit Sonotech?
Yeah.
You see, like we say, one-stop shop for everything. If it comes to medical, let's say anything medical, then I will tell you Sonotech is a one-stop shop where you get to and then talk of ultrasound. I mean, from your general practitioner to your specialist, your scans, your CT scans, your MRI. I mean, the specialist even directing you as to what to do. It's only cool. Sonotech you can get it. Yeah. So that's Sonotech for you.
Oh, I've enjoyed that. So that I can tell, can attest to that. Now, Doc, before we go, your final words on breast cancer.
Yeah. So I mentioned earlier, early detection, effective treatment saves lives. Perhaps I should make this comment about we the men. We have a big role to play. So as a man, if you detect anything in your wife's breast, you should push her. You should encourage her. If she has seen or felt something that needs attention, you should also encourage her. Now, the treatment of breast cancer is something that I wish as a country, or as in, it's something that everybody should make that effort. If you find someone whom you know who is a loved one who has developed breast cancer and is undergoing treatment, I think you should give the person every form of support that you can. If you have the money to do that, just do it, so that you are talking about a loved one. It's a debilitating disease that is living with a loved one, and it's maybe curable if the person comes early. But treatment is, as we know, it's expensive and all that. So we need every support. The men should give support to the women. Don't threaten your spouses or partners if it becomes necessary to take off their breast. If you find out their hair they are getting disfigured or something, these would improve when the treatment is over. And it will be better if they undergo treatment and we attain the cure we want.
All right. Thank you very much. But if you need more information on this, do well to contact us here at Adoatv. We'll give you all the details that we have. But it's from the 1st to 31st of October. So do well to join this campaign. Get yourself screened. Let's get this done together. My name is Naa Falikwaku. Thank you so much to Sonotech and to Dr. Benjamin Fenu. If you need any of their services, please contact us. Thank you very much.